Hello, good evening, everyone. Myself, Dr. Prashant from India. I'm working with the Datta Meghe Ayurvedic Medical College as a professor in the Department of Ashwastra. Next slide, sir. Next slide, please.
Can you go with next
Next
slide,
slide, please.
Team Magnus?
Yeah. So first of all, I would like to make some disclaimer that the presentation is a collection of internet material. Hence, the author doesn't claim any copyright or personal opinion. The presentation is for the upgradation of the medical knowledge and used for the betterment of the human being. Next slide, please. So current important hot topic is the dyslipidemia. Ayurveda and dyslipidemia, a holistic approach to the managing cholesterol. So today we took this topic in a view of the use of this statin groups to lower the statin group in the patients. So what is the agenda of today's presentation? Is the first one is the introduction to the dyslipidemia, overview of the Ayurveda, understanding the lipid profiles, and a few important herbs which has been used in the Ayurvedic field, that is ajwain, arjuna, haldi, trikatu, sunti, and chitrak. That is the carom seeds, terminal arjuna. Haldi is the turmeric. Trikatu is a combination of ginger, black pepper, and long pepper. Sunti, that is the dried ginger, and chitrak is the plumbago jelenica. Next one. So what is dyslipidemia? Dyslipidemia is refers to abnormal amount of lipids in the blood, and including elevated levels of LDL and reduced levels of HDL, cholesterol, and increased triglycerides. So what is the prevalence and the impact on the health? Is dyslipidemia is increasingly prevalent globally, significantly contributing to the CVS, with the remains leading cause of morbidity and mortality. So what is the importance of managing lipid profiles? Is proper management of lipid profiles is crucial for serious health and preventing atherosclerosis and reducing the risk of heart attacks and the strokes. Next one. So what are all the components of the lipid profile? That is the component measure is the LDL, HDL, and the triglycerides. So lipid profile measures level on the LDL, HDL cholesterol as well as triglyceride and the critical indicators of CVS risk. High LDL and triglyceride paired with the low HDL can signal the dyslipidemia. So what it can impact, that is the heart health implications on of the dyslipidemia. Dyslipidemia is the significant risk factor for heart disease. It is contributes to plaque formation in arteries leading to atherosclerosis. It may cause heart attacks and the strokes. So where Ayurveda can play important role to control all these things there. So how Ayurveda addresses imbalance in the lipid levels. So Ayurveda emphasizes the restoring balance through dietary changes, lifestyle modification, and herbal remedies that can be wisely used in the management of lipid profiles. Next one. So understanding dyslipidemia in both of perspective, that is the modern and the Ayurvedic correlations. So modern medical view, that is the imbalance of the HDL, LDL, triglycerides and low HDL, and directly linked to the CVS and significant global health burden. In Ayurveda, we can correlate with the Medo Strotas Drushti and Medo Vriddhi. That is the imbalance and accumulation of the fat tissue in the body. Excess kapha dosha leads to the sluggish metabolism and the fat accumulation and results in the elevated cholesterol levels. Next one. So what are all the causes of dyslipidemia? That is the causes of dyslipidemia is the various causes including the poor diet, sedentary activity, genetics, and the underlying health conditions. Understanding these causes are essential for prevention and management. Subtle symptoms are dyslipidemia may entirely abstain. This makes regular screening a critical step in early detection. Uh, Third one is the key risk factor, that is a high LDL, cholesterol, low HDL, cholesterol, and elevated triglyceride are the key risk factors are there. So what is the importance of the management? Effective management of cholesterol level is crucial to reduce the risk of atherosclerosis, and proper management also helps in the preventing cardiovascular complications. And what is the master stroke in this controlling this lipid level? That is the need of regular screening, which can win the bad symptoms. Next one. So what is the overview of Ayurveda? So basically, in short, we have to understand what are the principles of Ayurveda. Ayurveda is an ancient holistic health system from India, mainly focusing on the body, mind, and spirit, emphasizing prevention, health promotion, and treatment through natural methods. So Ayurveda majorly given importance for the diet and lifestyle basically in our daily human life. In Ayurveda, diet and lifestyle choices are tailored to an individual constitution, that is called as Prakriti, and a state of health, that is Vikruti, affording a personalized approach to the well-being. So what is the connection between Ayurveda and modern nutrition? Ayurveda principles echo modern nutrition trends such as emphasis in the whole foods, importance of digestive health, and use of specific herbs and spices to enhance the good health. Next one. So Ayurveda, in view of heart health and cholesterol, that Ayurveda is giving importance of dosha imbalance, specifically kapha disturbs the natural fat metabolism. It can impair the agni, that is called as the digestive fire. We are calling this as a metabolism, incomplete fat digestion and toxin build. Then it can introduce the ama formation, accumulation of metabolic toxins, further hinders the lipid balance, and at the end, there is a Medoroga leading to disorders like dyslipidemia and affecting the CVS. Ayurvedic treatment aims to restore dosha balance, basically Agni, and eliminates Ama, that is called as the toxins, through purification, that is called as Shodhana. Drying is Rukshana, and pacifying Shamana therapies. Next one. Next one. Next one. Next one. So, if you are going through this, what are all the powerful Ayurvedic herbs for dyslipidemia management? The major one is the Arjuna, that is called a terminal Arjunia. Strengthens the heart muscles and lower LDL and triglycerides. It can cause increase in the high density lipid. Second one is the Gugulu, promotes the lipid metabolism, reduces the low density lipid and triglyceride, and it can increase the high density lipid. One more is the garlic. Garlic can be widely used in the world. That in garlic there is a allicin compound that can reduce the LDL and triglycerides and support the blood pressure, and the Triphala, which can detoxify and improves digestion and fat metabolism. Other are also there. That's the fenugreek, turmeric, and coriander. In next slide, we will go through it. Next one. So what about this ajwain? So ajwain is the carom seeds. Nutritional benefits are also there. Ajwain is rich in dietary fiber, vitamins, and in antioxidants. It possesses the carminative properties that aid digestion and enhance the metabolic functions. It effects on digestion and lipid metabolism. Research indicates that ajwain can help lower cholesterol level and triglycerides, enhancing lipid metabolism through active compound. So recommended use and formulations for practitioners. Ajwain can be used as whole seeds and infused in teas. Practitioners can advise patients to consume about half a teaspoon daily and incorporate in meals for the maximum benefits. Next one. So in earlier slide, we have gone through it. That is the Gugulo. There are some studies which can indicate that Gugulo, that is the lipid lowering and anti-inflammatory benefits, can reduce the lipid level at margin at good level. Second one is the Arjuna, which can protect the heart and the lipid level also. And third one is the fenugreek. Fenugreek cholesterol absorption it can increase, and the lipid profile improvement having some properties, contains the soluble fiber that aids in lowering cholesterol absorption and improving lipid profiles. Fenugreek contributes significantly to healthy lipid metabolism and cardiovascular health. Next one. No, earlier slide. No, that is Google slide. Earlier. Huh. One more. Yeah. So this is the plant widely used in India, and most of the Ayurvedic companies are making the various drugs with this. That is called as Gugulo. That is called as Camicora mucul, and it is having wonderful properties to reduce the lipid level. Next one. Next one. That is the Triphala. That is a combination of ginger, black pepper, and long pepper. That is the role of tricotu in enhancing digestion and metabolism. Tricotu is a potent blend that stimulates digestion metabolic process, crucial for maintaining the healthy lipid profile. Effects on lipid levels, according to research study, which shows that tricotu can help to lower the LDL levels and promote high density lipid levels, enhancing lipid metabolism and supporting cardiovascular health. Practical application for health professionals. Health professionals can recommend tricotu in powder form, suggesting a dose around 1 teaspoon per day with warm water to increase the digestive enhancement. Next one. Sunti. Gingiva officinale is the Latin name of it. It can It is having some potential benefits on cholesterol levels. Sunti has been found to influence cholesterol metabolism positively, thus contributing to improved lipid levels in individuals with dyslipidemia. Traditionally used in Ayurveda to reduce the ama, that is called as toxin. In Ayurveda, Sunti is utilized to expel ama from the body, promoting overall health and supporting the metabolism of the fats. Ways to include Sunti in the dietary practices. Sunti can be consumed as a tea, added to the herbal decoction, or used in spice in cooking meals. A typical recommendation is to consume 1 to 2 gram in a daily dose. Next one. Uh, Again, we have to say something about Arjuna, because in India, most of the Ayurvedic practitioners are using this Arjuna for multiple uses for this cardiovascular symptoms as well as the lipid things. That is a traditional use of Ayurveda for heart health, known as a cardiac tonic. Arjuna traditionally used in Ayurveda to strengthen heart muscles and improve overall health, heart function. Scientifically, evidence supporting in rule to improving lipid profiles. Study demonstrated that Arjuna can significantly reduce the total cholesterol LDL levels while increasing HDL cholesterol and supporting lipid balance. So doses and preparation is mostly used in 500 milligram to 1 gram in a daily dose. Next one. So this is the plant in our own herbal garden of our institute, that is called Arjuna. Next one. So in sequence of this, one more plant is there, that is called Chitraka, that is the Plumbago gelenica. It is having benefits for digestion and metabolic function. Chitraka is recognized for potent digestive, metabolic enhancing properties, which can be beneficial for maintaining balance, lipid level. Scientific insights into its lipid profile, lowering effects. Research studies indicate that Chitraka may help to reduce LDL cholesterol, triglyceride, while increasing high density lipid, contributing to good heart health. Usage recommendation is the same, 500 milligram to 1 gram daily. Next one. So this is the plant available in our own institute, that is called a Chitraka. Next one. Worldwide available plant is nothing but the haldi, turmeric. Active component is the curcumin and its health benefits. It can curcumin, the primary active component in turmeric, renowned for anti-inflammatory and antioxidant effects, which can beneficiary for heart health and the cholesterol level. Anti-inflammatory properties related to dyslipidemia. Haldi can be used to show reduce inflammation in the body, potentially protecting against arterial plaque buildup and supporting healthy lipid levels. Incorporating haldi in the daily diet, practitioners can recommend incorporating turmeric into daily meals, teas, or supplements. Common recommendation is 1 teaspoon of turmeric powder with black pepper to enhance the absorption. Next one. So this slide is just giving some scientific evidence. It is the same slide as we discussed earlier. Next one. Next one, please. So clinical evidence with regard to some of the important drugs which has been used in Ayurvedic clinics is nothing but the Arogyavardhani. That Arogyavardhani is very good drug and it has been used by all Ayurvedic practitioners throughout the India. The in 2012 study shows the significant reduction in total cholesterol by the use of this Arogyavardhani Vati, LDL and triglyceride, along with the increase in high density lipid using Arjuna powder and Arogyavardhani Vati. Ayurvedic purification therapy, Virechan, it is one more thing is added here, that is called as Panchakarma therapy, has been observed to improve the lipid profile and elevate the symptoms in patients with the dyslipidemia. Next one. So why we should to think about Ayurveda with the modern care is nothing but the for looking the safety and efficacy. Clinical studies show no significant liver or kidney toxicity with the Ayurvedic treatments, can be used alongside modern lipid lowering agents, potentially reducing dosage requirements and side effects, emphasizing long-term lifestyle changes for sustained health. Next. Real world impact that a patient's outcome and testimonials has been given by all the patients who are coming to our own clinic, and just they are just saying like this, that my cholesterol level has been stabilized, I feel so much lighter and more energetic, digestion issues and constant fatigueness are gone. Ayurveda truly heal my from within. Likewise, the holistic approach address not just my cholesterol but my chronic backache and sweating. These are all the additional benefits. Next one. So one more plant is the pipli, that is called as the Piper lango. This is also used in the Ayurvedic practitioner. This is also anti-lipidemic. Next one, please. Next one. Next one. So, in addition to this, what are all the other therapies which can be used to reduce the dyslipidemia? Is the first one is the viration, therapeutic purgation to eliminate accumulated toxins and excess fat deposits from the body. Udvartanam, that is the mostly used in the Kerala side, that is the South India, South India treatment side. Herbal powder massage that stimulate fat metabolism, improve circulation and reduce subcutaneous fat. Abhyanga and Svedana, oil massage followed by herbal steam, balances doshas and enhancing body's natural detoxing process. And some personalized plan. That is, the treatment are tailored based on the individual dosha, assessment and severity of dyslipidemia for optimal result. Next one. So what we have to plan if the patient come with the dyslipidemia, that is a dietary focus, prioritize whole and unprocessed plant foods rich in the fiber, include healthy fats, olive oils, nuts and omega-3 rich fish, while avoiding saturated trans fats. Physical activity that has to be increased, which is called as Vyayama in Ayurveda. Unfortunately, that is taken in a different way in Western world. Vyayama is very different thing which has been given by Ayurveda at every Sahita level. There has been mentioned how to we have to burn the calories in a different ways. Engage in regular exercise to stimulate metabolism and counteract kapha imbalance, promoting healthy fat tissues. And one more thing which is the gift of modern world is the stress management. Incorporate yoga, meditation, breathing exercises to reduce the stress, which can positively impact heart health and the lipid level. And avoid the aggregators. Limit overeating, heavy meals, sedentary habits that can aggravate the Meghe dhatu and contribute the dyslipidemia. Next one. So in this way, if we go with the Ayurvedic herbs, why they can use as an anti-lipidemic? That so what is the upper hand of the Ayurvedic drugs on the modern medicine? First one is the safe, second one is the natural, lesser side effects, cost effective because we know what are the cost of the statins and other anti-lipidemic drugs given by the modern physicians. Then the easily available, and there is no or other we can say there is a lesser R&D cost. Next one. Easy combinations are available. It is palatable. These Ayurvedic herbs can be act as a micronutrient. So one more study is needed to make this kind of the claim. Improves the metabolic cycle. Sometimes these drugs can be act as both dyslipidemic and the cardioprotective agent, just like as Arjuna, as we discussed earlier. Next one. So in short, safe medications without side effect is the need of our. Ayurveda can provide better combinations in dyslipidemia. Further insight is needed on this topic, and collaborative research can be promoted where we can go with the multiple MOUs to making some concrete clinical data. Next one. So thank you very much for patiently listening my this topic, and again I am very much thankful for the organizers for giving me chance to present my topic and my knowledge at this international event. Thank you very much.